Hello, and welcome to Pancreatic Cancer Warriors. I'm Dr. James, and today, we're going to delve into a question that weighs heavily on the minds of many patients and their families. Is the pain from pancreatic cancer constant or intermittent? This is a question I hear frequently, and while the experience of pain is deeply personal and can vary significantly from one individual to another, there is a discernible pattern that often emerges as the disease progresses. Understanding this pattern, this pain journey, is not just an academic exercise. It's a crucial tool that can help you decode the signals your body is sending. By learning the language of this pain, you can communicate more effectively with your healthcare team, leading to better diagnosis, more timely interventions, and more effective pain management. There isn't a simple, one-size-fits-all answer, but the evolution of the pain often tells a compelling and clinically significant story about the cancer's progression and its impact on your body. The most common trajectory we observe is a shift from pain that is initially intermittent and somewhat ambiguous, to a pain that becomes persistent, constant, and unfortunately, much more severe. In the earliest stages of pancreatic cancer, the pain, if present at all, is often frustratingly intermittent and vague. Many patients describe it as a fleeting discomfort that comes and goes without a clear trigger or predictable schedule. One day you might feel a dull ache in your upper abdomen, and the next, it's gone, only to reappear a few days later. This pain can be easily dismissed or misattributed to more common, less serious conditions. It might feel like a persistent case of indigestion that doesn't fully respond to antacids, or perhaps a nagging low-level backache that you blame on poor posture or a minor muscle strain from lifting something heavy. The pain is typically localized, often centered in the upper abdomen, just below the breastbone, or sometimes felt as a diffuse ache in the mid-back area. Because of its sporadic and non-specific nature, it's incredibly common for individuals to overlook these early warning signs. You might find yourself thinking, "It's probably just something I ate," or "I must have slept wrong." This ambiguity is one of the most challenging aspects of earlier stage pancreatic cancer, as the symptoms don't immediately raise the alarm bells that a more intense, constant pain would. It's a whisper of a problem, not a shout, which unfortunately contributes to delays in seeking medical evaluation. As the tumor continues to grow, it begins to exert a more significant and direct influence on the surrounding anatomy. The pancreas is situated deep within the abdomen, nestled behind the stomach, and in close proximity to a complex network of vital structures, including major blood vessels and, crucially for our discussion, a dense web of nerves. One of the most important nerve bundles in this region is the celiac plexus, often referred to as the solar plexus. This intricate network acts as a major hub, transmitting pain signals from many of the abdominal organs to the brain. As the pancreatic tumor enlarges, it can begin to press on these sensitive nerve structures. In more advanced cases, the cancer cells can directly invade the nerves, a process known as perineural invasion, or cause significant inflammation in the surrounding tissues. This physical impingement and biological invasion of the nerve plexus is a critical turning point in the pain journey. It's at this stage that the character of the pain often undergoes a profound transformation. The intermittent, vague aches of the early stages give way to a pain that is more persistent, more present, and more demanding of your attention. Patients often begin to use more visceral, descriptive words to characterize their experience. They may describe it as a relentless gnawing sensation, like something is constantly eating away from the inside. This is when the pain truly becomes a constant companion, a background noise that rarely, if ever, fully subsides. The classic textbook presentation of pain associated with advanced pancreatic cancer is a deep, penetrating, and often severe sensation. When we ask patients to describe this pain, the word that frequently emerges is boring. This isn't boring in the sense of being uninteresting. It's boring in the sense of a drill bit, a feeling that the pain is boring a hole straight through their body. This profound, deep-seated pain is typically felt in the upper abdomen and very characteristically radiates directly through to the mid-back, sometimes feeling as though it's centered around the spine. This abdominal to-back radiation pattern is a hallmark sign that the tumor is likely impacting the celiac plexus nerves we discussed earlier. Unlike the intermittent pain of the early stages, this pain is typically constant and relentless. It doesn't come and go. It's always there, though its intensity may wax and wane. Many patients report that certain activities predictably worsen the pain. For example, the pain often intensifies after eating, as the digestive process stimulates the pancreas and surrounding organs, increasing pressure in the area. Another classic feature is that the pain can become significantly worse when lying flat on your back. This is because, in this position, the tumor and other abdominal organs can press backward onto the spine and the celiac plexus, exacerbating the nerve compression. To find relief, many patients instinctively lean forward or curl up into a fetal position, as this can help to alleviate the pressure on those inflamed nerves. This deep, boring, and radiating pain is a definitive signal of a more advanced disease process. This clear, observable evolution of pain, from an occasional, mild discomfort to a constant, unrelenting, and severe pain, is not just a symptom. It is a critical clinical signal. It tells a story of the tumor's growth, its increasing size, and its encroachment upon the sensitive structures deep within the abdomen. This shift from intermittent to constant is a clear indication that the disease is advancing. Recognizing this transition is of the utmost importance. It is a sign that your body is under significant duress and that the cancer is having a major physical impact. This is the point where proactive and aggressive pain management becomes absolutely essential, not just for comfort, but for overall quality of life. When the pain reaches this level of severity and constancy, it can be debilitating. It can interfere with sleep, appetite, mood, and the ability to perform even the simplest daily activities. Therefore, it is imperative that you do not suffer in silence. This change in your pain pattern requires urgent medical attention and a dedicated conversation with your oncology team, specifically about pain control. There are many effective strategies available, from powerful medications to advanced procedures like a celiac plexus nerve block, which can significantly reduce or even eliminate this type of pain. Understanding that this shift is a hallmark of disease progression empowers you to advocate for yourself and ensures that you receive the compassionate and effective pain management you need and deserve. Thank you for joining me today at Pancreatic Cancer Warriors. Remember, understanding the patterns of your body can empower you in your journey. Never hesitate to communicate every detail of your pain to your medical team. I'm Dr. James, and I look forward to seeing you in our next video.